Good morning. Good morning. Good afternoon. Good evening to everyone joining us from across the country and across the world, around the world. Welcome to our Careers in Health Informatics webinar brought to you by Minorities in Medicine and MelaninScience. We are thrilled to have you here for this important conversation on the future of healthcare technology and the careers shaping it. Before we dive in, let's take a moment to connect. Drop your location in the chat. Let us know how you're feeling with an emoji. We love to see the energy and the engagement from all of you today. This is going to be an interactive conversation, and we want to connect with you via the chat. My name is Waverly Rose Brim. I am an artificial intelligence graduate student studying at the Johns Hopkins Whiting School of Engineering with research appointments in neurosurgery and ophthalmology, where I build multimodal AI solutions, including computer vision and machine learning to investigate brain tumor microenvironments, brain tumor genomic profiles, and surgical operating room optimization. I'm also the founder of Minorities in Medicine. Next slide. So Minorities in Medicine is a 501c3 nonprofit organization, and our mission is to foster a culturally competent medical workforce. We do so by providing students with opportunities, paid internships, hands-on workshops. We have a photo here of a few of our students on site at one of our partners' sites at Yale New Haven Health in their simulation lab, where we have opportunities that we extend to our various bases, tiers ranging from high school all the way up to professional school students to have hands-on exposure and training. I'm also really grateful and honored to be working in partnership with Melanin and Science today on this event. And I will welcome to the stage the founder and CEO of MelaninScience to share with all of you more about our partnering organization, MelaninScience, today.
Hi, everyone. My name is Carmen Banks, and I am the CEO and founder of MelaninScience. I'm a senior scientist working in biotech focused on genome engineering and cell line development, as well as running MelaninScience. MelaninScience is an organization dedicated to increasing Black and Brown representation in science through education, career development, and mentorship. We host our flagship program called the Tech Connect program that connects students and young professionals with folks that are in the biotech or all other spheres of STEM for jobs and internships. And we also host a variety of different webinars and panels to further your education and career development.
Fantastic. Thank you so much. And we're really glad to be working with MelaninScience today. And I will be in the chat supporting all of you with all of your questions. And I'm excited to give the floor to Carmen and Savannah Brown to host today's program. Savannah Brown is a clinical laboratory professional who values integrity, safety, and wellness in all aspects of pathology and lab medicine. She works as a pathologist assistant and serves as the dedicated Chief Operating Officer of Minorities in Medicine. I'll hand over the floor now to Savannah Brown and Carmen.
Good morning, everyone. I'm Savannah Brown, and thank you both to Waverly Rose and Carmen. As Waverly Rose said, I serve as Chief Operating Officer for Minorities in Medicine, and I'm so grateful that you all are gathered here today and ready for our jam-packed program. I'll give Carmen the floor to introduce our first speaker.
Thanks, Savannah. So our guest speakers today will be Dr. Kendria Kelly-Taylor, Christopher Kunney, Alana Esty, and Dr. Brittni Moore. Our first speaker will be Dr. Kendria Kelly-Taylor. Dr. Kendria Kelly-Taylor is a postdoc research fellow at Kaiser Permanente, Northern California Division of Research. Dr. Kelly-Taylor is a trained epidemiologist, and her research focuses on exploring the role of social and structural factors on racial and ethnic disparities in perinatal outcomes, including birth outcomes and mental health. I'll now give the floor to Dr. Kelly-Taylor for her presentation on career pathways and industry trends in bioinformatics.
All right. Good morning, afternoon to everyone. First and foremost, I want to say thank you so much for allowing me to be on this panel. This is a really incredible group of individuals that you all will get to hear from today, and I'm excited to be able to bring my level of expertise. I will also say, just as a disclosure, anything that I do say today does not reflect necessarily my industry or my particular job position. However, these are my opinions in which that position has also helped me shape. So as Carmen mentioned, I am a trained epidemiologist. I do a lot of work in perinatal and mental health, and specifically, what I really wanted this slide to really showcase is how epidemiology, public health, and health informatics really go hand in hand nicely. So here we have a word cloud that I really want you all to take a second to really think about how all of these things in the interdisciplinariness of health informatics really showcase here. And so things that are really, really important when we're thinking about public health, epidemiology, and health informatics, when we're thinking about our career paths, is how do we create the bridges? So things around disease, things around data. How do we think about data management? How do we utilize our healthcare systems, our electronic health records? How do we think about surveillance? And ultimately, through my lens, most importantly, how do we really bring all of this together through an equitable lens? Next slide, please. So when we think about career paths, I have to give you all my quick story in my career path. And this is really important because there is no one set path to follow when we're thinking about these fields, specifically health informatics. As I mentioned earlier, it is extremely interdisciplinary. So I am a graduate with a Bachelor's of Science in Movement and Sports Science from Purdue University. And following that, I went to Meharry Medical College, a historically Black college located in Nashville, Tennessee, where I received my master's in public health. So this is really where I learned a lot of my training in epidemiology and biostatistics, but most importantly, my lens of really pursuing health equity and really considering that in every part of my research. So following that, I moved to Louisville, where I got my doctorates in public health with a concentration in epidemiology and population health. And then as you see in the last corner of the slide, as Carmen mentioned, I am a postdoctoral research fellow with Kaiser Permanente, Northern California Division of Research, specifically in the Women and Children's Health section. And I get to do a lot of really interesting work where I get to bridge concepts around intersectionality and health equity and racism and mental health, and really considering how all of these roles really play a part. And most importantly, I get to use big data to do all of this. Next slide. All right, so I think what you guys really all came here to think about is what is some advice on these career paths. And so this slide took me a second to really think through because, as I mentioned, career paths can look really different. So I want you all, if you are an undergraduate, here are my top advice, and I think this really goes across any level, but first and foremost, please identify your passion. Okay, oftentimes when we go into these fields, especially these ones that may seem very specific, a lot of data driven, maybe management, things of these natures, sometimes we forget how does our passion also align to this. So I would advise anybody who's in undergraduate right now, please identify your passion first, okay? Then let's consider how do we layer on the importance of a lot of these STEM fields, especially if you are Black, Brown, or of another minority, really thinking about how do we integrate in our lived experiences with these sciences, technologies, engineering, math, agriculture, etc. And so when we're thinking through our undergraduate lens, you don't necessarily have to major in a STEM field. Of course, you will, it may help, of course, but you don't have to. But really think about if something is really a passion of yours or you really enjoy STEM, think about how you can integrate this within your undergraduate experience. The one thing I will say, which is always going to be the most important, you have to network, 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 network. And this can be extremely intimidating as an undergraduate, and honestly, even as a graduate or early stage investigator or professional. But networking is so important. So really try to push your limits there. Try to consider thinking, talking to your professors, understanding maybe how they got to their particular spot. If you this call right here, reaching out to someone on this call that you may like some of the information that they're saying, make sure that you really, really prioritize networking during this time. And then most importantly, also for a lot of these fields, and as you'll see as we go through some of the other panelists, graduate level schooling is probably going to be relatively encouraged. And so what's really interesting and fun about the graduate level is that this is really when you can hone in on some of those things that maybe you didn't get while you were in undergraduate. As I mentioned, I have a bachelor's in exercise science, so I really didn't get to introduce public health until I went for my master's level. And so it's really important that the graduate programs that you decide to do really can help booster and hone in on some of those skills that maybe you were not able to get in the undergraduate. Now, for our graduate and early professionals, my first point, once again, is going to be please, please, please network. So it's really important we're getting to our conferences and really leveraging our social platforms. LinkedIn is a great platform to learn how to network. It's kind of like the new age of Facebook for professionals. And so it's really important that you use these platforms to really get yourself in the door. Never be afraid to send a cold email. I am a big advocate of this. You'll be very surprised how well and responsive people are to that. So just always remember how important it is and make sure you put it at your forefront to make sure you network. Make sure your CVs and your resumes are up to date. Have them in a digital form. A lot of times we don't like paper copies. So make sure that you have those things in a digital form. There's a lot of apps that you can utilize to do that as well. Another really important one is your internships or externships, depending on your institution. So these really are going to be a great way for you to start off your career path. Oftentimes these are done while you're in your coursework. And so if you do a really great job, this can be your first stepping stone into maybe some of your first employment and or future employment down the road. Once again, continuously in keeping those connections that you make during those opportunities. And identifying different internships, whether or not that be in your subject content or maybe something that's not necessarily. Don't be afraid to kind of broaden your horizon in those opportunities, because you never know how well they may bridge with what you're already doing, but really elevating your experiences or your expertise in things that you may not recognize are already there. My third point is leverage your experience. So oftentimes when we're in graduate school, as I'm not too far removed from being in my doctoral program, when we are in graduate school, sometimes it seems like we don't have experience, right? Or our experience is really honed in on our schooling, right? So whether that be our research or different opportunities that happen in that. And sometimes we don't think we may have this practical experience, but really you do. So a lot of times, especially when you're in your graduate level, you are a project manager, you're a data manager, you are really a lot of different expertise. And so really the most important thing and the best advice I can get is learn how to leverage those experiences and leveraging them in a way that you can talk about them to say, hey, I did this particular thing and this is how it can help me with X, Y, and Z. So don't discount your educational experience as also practical experience, because it is very valuable. And then for those who may be thinking about career shifts or just trying to get into the doors, fellowships are also a really great way. I will do a plug for Kaiser. They have a delivery science fellowship, and we see people from all different lenses come into this fellowship. This is a really great fellowship that bridges patient care, data, and really considering how we deliver, once again, healthcare. And so this is a really good fellowship. Oftentimes it does require to have a doctoral and or clinical degree, but we get to see people from a vast different areas of expertise come into this fellowship at different levels. So I think entertaining fellowships, especially if you were considering shifting careers or anything like that. Next slide, please. Okay, and then I'll wrap up with the fun slide, which is some of the trends that we are seeing in health informatics and honestly public health and a lot of different disciplines and fields. So number one is our integration of AI and like machine learning, right? So the use of AI and machine learning, there's a really big increase in popularity and the utilization of both of these. Really to assist in our effectiveness of clinical care, specifically if we're thinking across the health lens. So a really good example of this, if you all have heard of like natural learning processes and modeling, these are really different techniques that we can utilize to help us in predicting like disease management or predicting like high risk individuals within our healthcare system. And also ultimately the goal of doing these things is to really assist in our clinical decision making. So anything that aligns yourself with AI, these different kind of modeling and big data modeling are really going to be some increasing things that we see continuing to increase over the next few years. The next top three kind of industry trend would be our data integration and sharing. And so really the biggest thing here is thinking about across all of these different platforms, how do we really share data in a more standardized way? And so this is really important as we think about a lot of our healthcare systems moving to a more electronic platform. So as I mentioned earlier, electronic health records are really something that we see a lot of and a lot of different other healthcare systems. And so with that being said, we really want to think about how are we sharing data? Are we doing it in a private and confidential way? Are we doing it in a standardized way? How is this going to be the most efficient and effective? And then lastly, we have digital health and telemedicine. As we all know, COVID-19, the pandemic really shaped and really transformed our health in the sense of really utilizing digital and telehealth medicine. And so what's really important here is that we're thinking about virtual care platforms, a lot of these health apps that we may not be considering, a lot of wearable devices. So now when we're thinking about these big data, how do we use things such as like our Apple Watch device, people who may work in tech around Apple Watches. And so we have these health data, and then how do we integrate that and utilize that for research, for example? That's something that an epidemiologist could utilize to figure out how we can improve certain metrics. So really considering health data and telemedicine is really important. And ultimately, I will say, I believe it's on the slide, you may have to click, Carmen. Ultimately, the biggest thing here is really how do we really think about industry things through an equitable lens? As I mentioned, I am a very big advocate of we can have a lot of increased ways to do data. We have a lot of advanced techniques, but one of the things that we have to be very crucial and critical of is making sure that we are not perpetuating inequities while we are building this incredible field. And so really at all of these different industry trends at all the different academic levels, really consider how are we doing the most equitable work, because the ultimate goal is greater health for all mankind. So that is my part. Thank you.
Thank you, Dr. Kendria Taylor. And introducing our next speaker is Christopher Kunney, a brain tumor survivor and now managing partner of ILTech Consulting. Christopher is also the host of the critically acclaimed podcast, Straight Outta Health IT. Christopher, the floor is yours.
Hello, everyone. I'm Christopher Kunney, and it's a pleasure and an honor to be a part of this conversation today. I was asked to really give you some insights about what are some of the skills and certifications and areas that we find most attractive for folks who are pursuing careers in healthcare informatics. My background is a lot of years, 3 decades or more in the technology space. I spent about 1/2 of my career in the commercial market working with companies like Hewlett-Packard and Verso Technologies and various other organizations. And then I moved into healthcare in the early 2000s, where I worked on the provider side and served ultimately as CIO for a large healthcare system here in Atlanta, Georgia, where I'm based, and a fractional and virtual CIO for a wide variety of different organizations across the US. I've also had the privilege of serving as an industry advisor for companies like AT&T and Samsung, Ricoh, QTS, many other large corporations, as well as startups. And IoTech Consulting is a healthcare technology advisory and solutions firm. We work with, again, providers, government agencies, academic institutions, and a wide variety of organizations within the healthcare ecosystem. We also serve as advisors to startups and investors in emerging technology companies, that's specifically targeting companies who are dealing with health disparity and health equity issues. Today, I wanted just to share with you this, this whole industry around health informatics and health data science is really something that's hadn't been around that long. When you think about the adoption of technologies like the electronic health record systems and telemedicine and now AI in healthcare, I mean, these technologies have been around less than truly 2 decades, or at least actively adopted within healthcare. And so because of the adoption of these emerging technologies, we find now the need to leverage the insights that are coming from the data that's collected. It is the insights that create information, knowledge, and allow us to find ways to provide better deliveries of care, improve operations, and address those gaps that we see within our overall ecosystem. So I just wanted to touch a little bit about some of those high-level technical skills. I'm sure you guys will get the slide deck here, so I'm going to run through these fairly quickly. And if you have questions on the back end, we can talk about that at that point. But, obviously, coming into an industry that's looking at informatics, having a background in data management and data analysis is absolutely key. Being interested in learning how to drill down into this information and gain insights, being able to leverage tools in order to do that, like SQL and Python, Tableau, and others, are going to allow you to be more proficient in the analysis of this information. And as my colleague earlier mentioned, the adoption of technologies like electronic health record systems and telemedicine systems, HIEs, and many others that are now standard solutions within healthcare are tools and technologies you as individuals will need to gain some level of understanding and proficiency in, because that's where the data is now being collected. And those are the systems and technologies you're going to be gaining access to extract that data and to provide analysis around it. So understanding interoperability standards like HL7 and FHIR, as well as understanding the different nuances associated with these technologies is going to be extremely important. Next slide. Again, your role as an informaticist is to take data and drive insights and actionable information from that. So your ability to, drill down into this information, understand how this information is having an impact on the different areas that you may be asked to provide some analysis on. And that's not just the clinical side. That could be the operational business side, the security side. It could cover a wide variety of parts of our healthcare ecosystem. But your goal and your responsibilities will ultimately be to aggregate that information, create actionable insights from it, and present it in a way that helps decision makers make more sound and informed decisions as well, too. Also, understanding parts of the systems that drive the creation of this data, such as clinical decision support tools, things like e-prescribing, clinical notes, the different aspects of the tools that are being used to collect information. It's going to be important for you to understand, whether that's discrete data, whether that's, other types of data that's being collected, and how that data can be, again, leveraged in a way to help you understand better what the current state of affairs are in the areas that you're responsible for. Next slide. So what are some of those core soft skills? It's not just about the technical aspects of this, right? Understanding the tools and technologies, but also you're having to present data to decision makers and influencers and helping them understand better how to drive insights from that. And so your ability to work effectively and communicate effectively with leaders at all different levels in the organization, and individuals with all different levels in organizations are extremely helpful. Whether you're working for a provider or a payer, security company, government agencies, academic institutions. Your ability to articulate the information that's being shared and work effectively with those decision makers is going to be paramount to your success. And many times you're going to be asked to lead or be a part of projects that are driving these data insights. And so you may have to develop much more robust project management skills, understanding different methodologies like Agile and others that are being used to help manage projects and drive decisions. It's going to be also equally important to gain some experience, proficiency, and expertise around as well. And I think most importantly, helping organizations understand how and lead them through change. This data in many cases will help organizations realize that they may have to shift the way that they do business today, the way they may have to modify their workflow. They may have to change the way they do business in general, and helping them navigate through those changes is one of probably the most important aspects and strengths I think an individual that's taking on this responsibility should continue to foster and develop. Because once you understand what those issues are, and once you understand the direction you want to go, now you got to influence and empower others to start to drive the adoption of those changes within an organization. And sometimes that can be the most difficult and challenging part of this job. And so facilitating technology adoption and guiding organizations through these transitions is going to be a strategic part of your responsibility and skill sets you need to foster and develop. Next slide. It goes without saying that healthcare is one of the most heavily regulated industries in the country. It's equally important to understand that the federal government and states have mandated the protection and security of patient information. And so we have to be very hypersensitive to how we collect, leverage, and use patient data in order to drive insights and make decisions. And so having a thorough understanding of our federal and state privacy and security rules are going to be important, especially as you start to mine patient data, and being familiar with the policies and procedures and mandates associated with that, and the requirements that healthcare organizations may need to follow to meet some of their government requirements, things like meaningful use and MACRA and other requirements. You may be asked to collect data and aggregate information to support some of those ongoing reporting mandates that organizations have. So having a good understanding of what those mandates are, understanding of what an organization's responsibilities are to ensure the privacy and security of patient information, and then understanding how to best deliver that information in a way that still allows you to get the insights you're looking for, but also make sure that you protect patients' privacy. It's equally important. Next slide. Certifications. I mean, I often get asked by individuals, what type of certifications should I pursue as I'm starting to navigate this career in healthcare informatics? And the beauty about this industry is it is ever evolving. Again, just less than 2 decades ago, we didn't even have degrees, quite honestly, actively in this space, or at least they were emerging at that time. And so this industry continues to evolve in the space of how we continue to leverage data and how do we look at skill sets and certifications needed to help us advance our careers in this space. And so there's all sorts of ones. These are just a snapshot of some that I'm familiar with and that I think could add value in your career growth, especially for individuals who are early entry level into their careers. It is important for you to think about opportunities to gain those certifications, especially if you don't have a lot of real world experience. The certifications will help give you some credibility, that you have some basic understanding of the profession that you're pursuing. And so organizations like HIMSS, the Healthcare Information Management Systems Society, is a well-respected international organization that has a number of different certifications in this area. They have one specifically for entry-level individuals called a CA-HIMSS, as well as they have an advanced level certification called CP-HIMSS and a fellowship certification, and others around informatics as well. And I encourage you to check out HIMSS as an organization and then go to their professional development area, and you'll see the different lists of certifications that exist there. And there are many other industries or organizations or associations that offer certifications as well. Organizations like AHIMA, ACHE, and many others can offer professional certifications and fellowships that will help to strengthen your background and gain you greater exposure and make you much more valuable as a resource in this industry. And then this industry has so many different verticals now that are emerging, whether it's security or whether it's on the data aggregation side or any other areas. There's all sorts of different types of certifications you might pursue. It all depends on what your interests and career pursuits are. Things like certified health data analysts and certified professionals in health informatics are just a couple. And then there are EHR certifications that may be important for you to achieve too, for organizations that you might be providing support for. For example, Epic being one of the largest and most adopted EHRs in the country has its own certifications that you could achieve, as well as other EHR companies like Cerner, Meditech, and many others have their own. So it all depends on the direction you want to take your career in terms of where you want to pursue certifications, but it's absolutely an important factor to consider as you start to develop in your career and try to figure out the lane you want to pursue and the opportunities to get additional education and expertise in those areas. Next slide. Again, some additional certifications, there may be, for those, and it's really interesting, people that move into this space come from all different sectors. Some come from the healthcare side. They were former, doctors, nurses, healthcare professionals. Some come from the technology side, like myself, who degrees were in computer science and masters in management technology that moved into this space. And then some come from completely outside of the industry itself and want to pursue careers in this space from the academic side and others. And so you can pursue a number of different of these certifications based on where your interests lie. I won't read the slide deck there, you can see there's cybersecurity certifications, certifications around health information management that will help you grow your career going forward. It all, again, depends on the areas where you have interest and expertise or you want to develop existing expertise going forward. Next slide. And then finally, and my colleague mentioned earlier, as you start to move down this path in your career growth and development, networking and building relationships and getting plugged into the healthcare ecosystem is absolutely important and imperative for the advancement of your career. So I highly recommend you consider getting involved in these associations that we mentioned and go and look for others, things like organizations like HIMSS and ACH, AHIMA, National Association of Healthcare Service Executives, and many others that are out in the marketplace that will help you connect with other healthcare professionals, find mentors, sponsors, and maybe even new career opportunities are absolutely important. And I do encourage you that if you do pursue getting involved in these associations, it's not just to become a member, but become actively involved as a chapter leader as well. Join committees, get on boards, get involved as a volunteer. Those are great ways to, again, connect with individuals, learn more about the industry, and develop yourself as a professional in the industry going forward. And then there's a myriad of online courses and training you can take to continue to make yourself much more knowledgeable about what's happening in this career, in this industry going forward. I want to emphasize too, it's an ever evolving industry. So what I share today, 2 years later may actually be obsolete. So staying engaged in these associations allow you to be up to date on the latest and greatest of what's happening in the industry and allows you to become a much more valuable healthcare professional and leader. And then finally, I'll say that it is absolutely imperative and important that we are represented as people of color in this industry. As we look at tools and technologies like AI and machine learning and the natural language models that are being used, it's important that we have our own lens on those things so that we ensure that we reduce the amount of potential bias that could exist in the data itself, and that we're bringing our own perspective and lens and our own cultural views around how data is collected, aggregated, and the insights that come from it as well too. Next slide. Yeah. Okay. Well, I just want to say thank you again for the opportunity to share my thoughts and insights, and look forward to continuing the conversation on the panel discussion.
Thanks, Christopher. I'd like to introduce our third panelist, Alana Esty. Alana holds a master's in biomedical engineering and currently works in the field of health informatics. She is also the host of the podcast, Health MelaninScience. Take it away, Alana.
Hello, everyone. Thank you so much for joining. Next slide, please. Okay, so just a bit of background to myself. I studied biomedical engineering. I currently work in the health informatics field in Ottawa, Canada, and I love fries. Next slide, please. So before we really jump into what a day in the life of a health informaticist might do, we should level set and just define the term of what health informatics is. And here you have a quote from the Healthcare Information and Management Systems Society. But I'd just like to define health informatics as simply transforming raw, messy, and structured data into actionable information to improve clinical workflow and ultimately patient outcomes. Next slide, please. So during the height of the pandemic, internationally, many hospitals paused elective surgeries. And this was the case in the example that I've shown here at Phoenix Children's Hospital. The issue that they had was how to resume these deferred surgeries in a timely and efficient manner. To support this, a dashboard was created that could be viewed by multiple surgeons and support how they could prioritize these deferred surgeries. Instead of having a disorganized system of emails, paper notes, and other files, this dashboard housed necessary centralized information where clinical staff could easily navigate and plan their schedule on a day-to-day basis. So this example does not exist in isolation. If you search on Google Scholar, you'll see tons of examples of how clinical dashboards can be a part of the solution to improve patient care. Next slide, please. So onto the example, patients being readmitted back into hospital is a costly issue. For example, in 2018, the Canadian Institute for Health Information estimated readmission to hospital costs more than $2.1 billion a year in Canada. And most importantly, readmission back to hospital can lead to negative adverse effects for the patient. However, there's been several research papers which has shown a reduction in patient readmission rates when there's a follow-up call from a clinician. And this might be as a result of medication adherence, and patients might feel supported. So onto the example of what a typical day in the life of a health informaticist might look like. Imagine your boss wants you to create a report which can determine which diabetic patients might be at risk for readmission, so that this information can be flagged to community nurses proactively who are carrying out the follow-up with patients. So you might think as an analyst, the first step is to dive into the data, but really the first step would be to have conversation with clinicians. You want to make sure you're understanding the full scope of the problem before you start doing any additional analysis. This could look like asking the community nurses, what are the key characteristics of those who are often readmitted back into hospital? Do they tend to be on several different types of medication? Is it age-related? And this is where your relevant clinical experience might come in handy to help guide these questions. Once you have the correct frame of reference, the next step then would be to sort through the data. So in the next two slides that I'll be showing, you'll be watching a demo of how I walk through using SQL, which stands for Structured Query Language, so writing these SQL queries. And then in the next slide after that, I'll be showing a demo on how to use Power BI, which is a data visualization tool. So in the demo that you'll be seeing, this will be using completely fake dummy data. It does not contain real patient information. However, it's replicating about 10 hospitals and some of the information in there. So I really want to highlight in these next two slides when you're seeing the demo, SQL, which is the structured query language, which is a programming language that is used to interact with data stored in databases, to be able to sort through all different types of healthcare data that exists, from healthcare claims, blood work data from the labs, and patient demographic information. SQL is a programming language that is used to sort through tons of data and organize messy data into actionable information. And the second tool I want to highlight is Power BI. This is a business intelligence tool developed by Microsoft to create more advanced charts and graphs than what you would see in Excel. And the hope is to better visualize and present data for non-technical and technical audiences. So I'll have Carmen move to the next slide, please. So here we are in SQL Server Management Studio, and I have my data written over here. So we have one table, when I execute this, that has the patient demographic information of these diabetic patients. So these can be things like the health card number, the patient number, the race, the gender, age, weight. And then we also have another table that has the diagnostic information. So the number of lab procedures, how long they've spent in the hospital. Example, time in hospital. So this is another common metric known as the patient length of stay. And this is the time that the patient was admitted to the time they were discharged. And then, of course, we have our outcome variable, which is if they were readmitted back into hospital. So we might want to join this patient diagnosis table with the patient demographic information together. So to do that, we would do a join clause. And so now we have both the patient demographics table and the patient diagnosis table joined together based on the common column that they have, which is encounter ID. And then we can do some further quick analysis. We can take this table and see, broken down by gender, female versus male, how many patients have been readmitted back into hospital, to see if that is a characteristic that we might want to note. So here we have a count to count the gender. We have a group by to break it down by gender and if they're readmitted back into hospital. So here we have a very basic report created in Power BI, and it just kind of summarizes some of the analysis that was done in SQL and the other technical tools into more graphs and charts that can be easier for people to understand. And with Power BI, one of the great aspects of it is the filtering capability. So if I select this graph, you'll see the number will change. If I select here, the number will change as well. And then you can even have things like buttons, which can make your report more interactive for users. So again, I would definitely consider learning a tool like Tableau or Power BI Desktop if you're interested in a career in health informatics, because it allows you to create products for the end user in a way that's easier for them to understand. Great. So hopefully the demo was a bit informative of how you can use some technical tools like SQL queries and Power BI. So in summary, the health informaticist or a healthcare data analyst role might look like having conversations with clinicians, sorting through lots of data, writing SQL queries, creating your graphs and tables in a data visualization tool such as Power BI, presenting your findings, and then oftentimes this can lead to further questions that might cause you to go back to step one again. So it's a very interesting career, and if anyone has any further questions, you can definitely reach out to me at healthanalyticinsights@gmail.com. I'll just have Carmen go to the next slide, please. Yeah, you have my email there, and I also have a YouTube channel called Health Analytic Insights, where I talk a lot about the field of health informatics and some of the technical aspects of it as well. So I'll now pass it on to Dr. Brittni Moore. Thank you.
Yes, thank you, Alana. Those videos really help to illuminate your point. And rounding it out for our final speaker is Dr. Brittni Moore. She has earned her PhD in cellular and molecular physiology from Johns Hopkins School of Medicine and now works as the Associate of Strategy and Decision Support at Blackbird Laboratories. Dr. Moore, the floor is yours.
Thank you, Savannah, and hello to everyone that has joined the webinar today. It's an honor to be a part of this conversation today, and I can only imagine that I'm going to repeat a lot of the great information that my colleagues have already shared, but hopefully you can take away something helpful here. So next slide. Yeah, so I always tend to like to start by just kind of sharing a snapshot of my journey. And this is mainly because we never know at which point we might connect or something that we might share in common. So in the top left-hand corner there is a picture of where I grew up. I was born and raised in the middle of Oklahoma in a town called Broken Arrow. So this is not an exaggeration. It is a very rural area with not a lot of resources and access to healthcare. And so I graduated high school and I shortly went to Pepperdine University. So that's the second picture there in Malibu, California. So it was a wonderful view. I enjoyed being around the beach for the majority of my undergraduate career. But there I earned my Bachelor of Science in Sports Medicine. My Bachelor's of Science in Sports Medicine. Shortly after graduating, I wanted to gain more experience with data science and research in healthcare systems. So I moved to Bethesda, Maryland, where I did a 3-year post-bac fellowship at the National Institutes of Health. So that's what the third picture on the top panel is showcasing. Bethesda, Maryland is a wonderful place if anyone has had the opportunity to visit. But the NIH is just this robust community of healthcare professionals and scientists alike, where I spent a considerable amount of my time learning and engaging, but then also kind of deciding what my next steps were. So I went to I just completed my PhD at Johns Hopkins University. My PhD is in cellular and molecular physiology, so a very basic science discipline. However, it was an incredible place to be. I love Baltimore City. If anybody has been or planning to go, I think it's great. And I think Waverly can attest to that, hopefully. And now currently I am at Blackbird Laboratories. So Blackbird Laboratories, if anyone's not familiar, we are a new venture capital fund that is started here and based in Baltimore, Maryland. So I include the last picture of the Baltimore Ravens because my fund was actually started by the owner of the Baltimore Ravens. So the Stephen and Renee Bisciotti Foundation gave us $100 million to invest in early stage ideas in academic research that has some commercial potential. So that's all to show. I started from Broken Arrow, Oklahoma, and went through graduate school in a very basic science discipline. And now I'm at the intersection of business and science and venture capital. So if we can go to the next slide. One of the reasons that I was very grateful to have the opportunity to speak with you all today on this panel is that in venture capital, I work in collaboration with many health informaticists, mainly identifying gaps in healthcare and data processing and understanding some of the unmet needs, as well as deploying capital to address those needs. So on this slide, I'm kind of summarizing some of these tips for newcomers, as I'm also still learning and have a lot to learn. But some of the bigger areas that I've identified is one of the first things you want to do is build those technical skills in data science and IT. And again, I realize my colleagues have already previously touched on these, so I won't spend so much time going into detail. However, health informatics heavily relies on data analysis, machine learning, and IT systems. So gaining technical skills is crucial. And if you're not already proficient in programming languages such as Python, R, or SQL, or even data visualization tools like Tableau, I think it's essential to upskill in these particular areas. And so some actionable steps one can take is taking online courses or attending workshops on data science, machine learning, and health informatics platforms. So websites such as Coursera, edX, DataCamp offer many courses specific to health informatics. And so it's one of those things where you can familiarize yourself with health data privacy regulations as well. The second point is just gaining familiarity with the healthcare systems and electronic health records, or EHRs. A deep understanding of healthcare workflows and EHR systems is essential in informatics roles. So you might already be familiar with aspects of healthcare, but it's important to understand how digital tools and data are used to improve those clinical practices. So some actionable items there, you can seek opportunities to work with or learn about EHR systems like Epic. Epic is a large one. And you can also look for internships and shadowing opportunities in hospitals, health tech companies, as well as some consultancy firms that specialize in health IT solutions. The third bucket of knowledge or tips is developing a solid understanding of health data and standards. Health informatics involves working with complex health data, a lot of big, robust data sets, such as patient demographics, lab results, clinical notes, medical imaging, and more. And so it's important to learn about healthcare data standards, current healthcare data standards that ensure interoperability across systems. And then finally, health informatics professionals often serve as a bridge between clinical practitioners, IT professionals, and administrators. So having strong communication and collaboration skills are essential for explaining technical concepts to non-technical stakeholders, which is something that I do in my line of work daily. And so some actionable items that I think kind of fit here is just working on your ability to translate those complex technical ideas into understandable terms for different audiences. So I already mentioned I trained as a PhD scientist, and although it was nerve-wracking the majority of the time, I was very intentional in working on my communication. So I took every opportunity to present in lab meetings, at conferences, and et cetera. So being able to participate in a lot of cross-disciplinary projects and collaborations with different teams can help you strengthen a lot of those soft skills when it comes to communication. Next slide, please. So we've already talked about networking, but I just kind of wanted to go into a little bit more granularity in terms of what I would say are your do's and don'ts of networking and trying to interact with people in the field. And so one of the first do's is being genuine to build real relationships. So networking is not just about transactional interactions. It's about, I think, building those authentic connections. So you approach people with genuine interest in their work and experiences, rather than just focusing on what you can get from them. So in a way to do this, ask thoughtful questions. You can listen actively. You can share insights that demonstrate your interest, but mainly focus on establishing the long-term rapport instead of those short-term gains. The second do is follow up and stay in touch. I get this a lot from students and trainees that I interact with, where we have a really nice interaction initially, and then we kind of, maybe on both sides, we fall off, or we don't keep and maintain those staying in touch. So one of my biggest do's is, after meeting someone, it's always appropriate, I think, to follow up with a thank you note or a message, but also mention something specific from your conversation to show that you were attentive. And I think that also helps people to remember you, familiarize yourself with where you guys connected. And that's going to help maintain that connection without waiting for a specific reason or opportunity. So I usually do this every time I go out to a different conference and I want to stay connected. I usually send a LinkedIn message or an email expressing gratitude, and hoping to continue a conversation. And then I'll actually periodically reach out with updates or insights that might be valuable to them. And then the last do is offer value. I think networking should definitely be a two-way street. And so offering to help share resources or provide useful information is always key before asking for a favor. So when you offer value, you are not only making a positive impression, but you're also establishing yourself as a resource to other people. So then we'll segue over to maybe the don'ts for effective networking. One of the things, don't be pushy or overly aggressive. So while it's important to be proactive, I think you should be weary of coming across as too aggressive or forceful in networking efforts. People are busy. People often forget to open things or follow back, and that is okay. And I think at the end of the day, people can sense when you're just trying to use them for personal gain, which can lead to any kind of awkward or disengaged relationship. So approach networking with patience and understanding that relationships take time to grow, and kind of refrain from immediately asking for favors or jobs or introductions right after meeting someone. The second don't is try to avoid small talk. So while I think small talk has its place, rely on it only to break the ice. Don't stick to surface level conversations or generic topics. Instead, focus on more of those meaningful discussions that reveal common interest or insights, which I think is one of the reasons why I like to kind of share my story, because I'm always eager if we connect in some way, some shape or form, based on common interest. And then lastly, don't forget to personalize your approach. Avoid and refrain from sending those generic or impersonal messages or connection requests. So whether you're meeting someone in person or reaching out online, I think it's best to always try to personalize your message to reflect some of the specific context of your interaction. And I believe that is all that I had prepared. So like I said, I know a lot of this maybe was a redundant information based on what the previous panelists have already shared and done a phenomenal job with. But this is just a little bit of how I would like to phrase the going from labs into leadership positions. And so as I will make a blanket statement, I'm always open to networking and connecting outside of this webinar. And so I think the organizers of today's panels will also show or share some of our information. So happy to connect. Just let me know this is where we met, and looking forward to the rest of the conversation.
Yes, thank you, Dr. Moore. And I want to thank all of our speakers for sharing with us today. And I want to thank our audience for holding their questions until the end. But we are now opening the floor for Q&A. And we will take one question from our registers on the Eventbrite. So our first question for our speakers is, what is something you wish more people knew about the field of health informatics, specifically the versatility of the degree? And that can be answered by anyone.
I'll start. I think that a lot of times folks think that their informatics degree they need to pursue an opportunity with a health system, a hospital or provider organization, when those career skill sets can be applied in a number of different areas on the academia side, research, private sector, commercial businesses, startups. There are a number of different ways they could, take that degree, that skill set, and leverage it with other organizations. They don't necessarily have to go and work for a provider. Payers are another area of opportunity as well too. And so I would say keep your options open to the different career paths that might be available to you.
Thank you, Christopher. Anyone else for that question? What is something you wish more people knew about the field of health informatics?
I was going to say that there's so many like disciplines within health informatics. There's like nursing informatics, pharmacy informatics. And so if you have a clinical background, you can be a very good candidate, especially, if you particularly work on it as a nurse and maybe you have experience with Epic, you're like a super user. That could be a good path to kind of transition into nursing informatics. So just that if you have a clinical background, this field is also a great opportunity for you as well.
Yes, thank you. As a PA, we use Epic constantly. So when you said Epic and Cerner, those definitely, my ears peaked open for those two. Kind of similarly, a second question from our registrants. There's a lot of questions related to pivoting into health informatics. How do you break into the industry? I see a lot of questions coming from that. So what would you recommend for those without a traditional tech background or without a traditional pathway? How would you recommend people pivot into this industry?
Yeah, I'll jump in again. I think that's where the associations can play a really pivotal role as well. Organizations like HIMSS and AHIMA, ACHE, and others will allow you to get plugged into that community of folks who are already a part of that ecosystem. So it allows you to network and connect with those individuals, gain additional education, and as we mentioned, certifications that will help to strengthen your credibility in the marketplace or areas of opportunity. Taking advantage of potential opportunities to do internships as well too as you're going through your educational endeavors. Being willing to even volunteer. I mean, there are nonprofit organizations and others that could leverage someone's background and experience in analyzing data. Will give you something to add to your resume as an area of opportunity as well.
Yeah, I would just second that, especially as someone who is an epidemiologist. So I'm not directly into health informatics, but I see the overlay. And so I would say definitely prioritize those internships, externships. And if you are in a position where this is where maybe you have, I think as Alana mentioned, maybe a clinical background, nursing background, fellowships in a lot of these different healthcare sectors and other sectors are really critical because you already come with a level of expertise that may not be the health informatics side, but you can build that and you can learn that in those opportunities. So I would definitely say that would be really important.
And I'll just actually piggyback right after you and say that while I'm also not directly involved in health informatics, being able to leverage some of those skills that you are gaining in other career fields can help also penetrate the field. I went to graduate school with a ton of people who did go into health IT, and they leveraged being able to analyze large data sets and computational biology that they learned in graduate school to be able to apply that to a health informatics field. So being able to really showcase and highlight some of those skills that might not seem directly transferable, but might also help you kind of penetrate it.
I think that's a really good segue into another question that's been asked, which is, what is the purpose of bioinformatics and what role does it play in the health field? So if you guys could talk a little bit about the relationship between bioinformatics and how it feeds into health informatics.
I'll jump in again. It's all about leveraging data, right? Whether it's bioinformatics, healthcare informatics, each of these require us to collect information in order to gain insights. And so you're applying the same types of tools, whether it's, someone mentioned SQL, SQL, and some of the other reporting technologies that are out there, AI, et cetera. Can apply in that space as well too. And I think that's what we were saying earlier. The discipline is so wide and deep in so many different areas. Bioinformatics, bioscience has an informatics component to it as well too. And so, research has an informatics component to it. Traditional, nursing, someone mentioned nursing informatics. There's a whole, information management component to how nurses manage patients and their workflow. So each of these disciplines have their own unique set of information that you're collecting and wanting to gain better insights around. And so I do think that any of these industries will have a need to have professionals who can aggregate, assimilate, and generate insights from data that's being collected through their unique disciplines.
Yes, thank you, Christopher. So I hope everyone has been taking notes, getting great information here. Question from the chat from Ellie Pierre. I would like to make a health technology idea reality after sharing my vision at a hackathon event, but where do I start? Should I seek mentorship first?
That's a great question. Yeah, I think as we had alluded to before, some of these large-scale health informatics organizations like HIMSS might have mentorship opportunities. I'm a part of several other different organizations, and usually they have like an early career or mentorship group part of it. So I would consider going to some of those organizations because they might have other people who have like healthcare startup ideas and things like that, and they might be able to help you provide some ideas around, framing and things like that. So I would consider going to maybe like a large healthcare informatics organization and seeing if they have like early career groups that you could join.
Yeah, I'd also comment and say there are a number of this health IT and health informatics community is very robust, and there are a number of startups, incubators, accelerators that are out there. I literally was in Washington, D.C. this past week with a company called MITRE, who just launched what they call MITRE Rise, which is a technology accelerator for healthcare, specifically targeting minority businesses who are developing technologies in this space. There are other organizations like Matter, for example, who offers similar types of tech accelerators. And then some of the local healthcare universities, organizations like Meharry, Morehouse School of Medicine, Emory University here in Atlanta, and many, many others across have tech accelerators that they are launching or have launched that are looking to develop startup technologies through their ecosystem. And then again, many of the hospitals as well are starting to launch their own tech accelerators also too. So if you just go out, and then as someone mentioned, getting engaged in those associations that are affiliated with that. There's an organization called Health, HLTH, that specifically is for startups and connecting startups with the VC and venture cap in the private equity community. They partner with another organization called Chime that has an event every year called VIVE, VIVE, where they bring that entire ecosystem together, providers, payers, startups, funding institutions, et cetera, to find ways to collaborate. And so there's a lot of different opportunities out there. I'd start with those associations and then start Googling, healthcare tech accelerators. And I promise you, there are a lot of them out there.
Yeah, and I would just quickly add, I think for the mentorship part, I don't think you should ever shy away. If you find someone that has, that you feel like can embrace your idea, I think in this space, buy-in is probably also a piece of the conversation as well. So having a mentor or having mentors with an S that can really help propel your idea is always going to be critical. So I think back to everyone's point on the call, that's really where your networking and stuff will really come in. So continue to do that.
Thank you all for that feedback. And we have time for one more question. So Lynn in the chat said, I'm in undergrad studying public health with a minor in health informatics. Are there any tips you could give a student who is about to graduate? Softwares I could use, learn for job hunting and other platforms?
I'm going to say, as a public health person as well, once again, not in the field, but never shy away from the softwares. If you can learn a software or have that technical skill, R, Python, I know in my discipline, I use a lot of SAS and Stata. If you can have those technical yes, expertise, that's always going to help you. It's always going to look good on any resume, CV, as you move forward. So I would definitely say if you have the opportunity to learn those things, get certificates, as many people has mentioned, even prior to graduating or right once you do, I think that's really critical. Most important thing, you get out that door. Whoever is the one that's graduating, you get out that door, you graduate, the things will be there. But yes, I definitely think any technical skills that you can learn, especially software related, data management related, is always going to just help elevate your current expertise.
Yes, and I'll add, just you're in the perfect position if you're still in undergrad, is leverage those opportunities. I will say Coursera is one of those underutilized platforms that a lot of undergraduates are already in collaboration with, so they can offer you a slew of healthcare courses online that you can also earn some of your certifications on. So definitely while you're in undergrad, even if you have a local professional school that's attached to your undergraduate, I know when I was an undergrad, I actually was able to transfer some of my credits to local professional schools. So if you can utilize that while you're there, I think that will also help you in the long run.
I'm just going to quickly add.
No, go ahead.
I was going to say, but it's because they said that they're in Canada. If you look up Health Tech Pulse, that's a digital health job board for Canadians. So just wanted to add that.
Nice.
Yeah, I was just going to add as well, too, don't sleep on the power of LinkedIn. I think someone mentioned this earlier in terms of job hunting and enhancing your personal brand. And I talk to folks a lot about this. If you go to any of our, and I encourage you to do it, go to any of our profiles on LinkedIn, you'll see that our brands represent who we are, the areas we're pursuing, the work that we've been doing. That this event will be on our LinkedIn post too. It's important to establish your own personal brand and what you want the world to view when they Google you or go into LinkedIn and pull up your profile. That's your first really resume, that you have in the marketplace. And so you need to make sure that that profile is representative of who you are today and what you want to be in the future. And it needs to be representative of all the other activities you're engaged in, like the conferences and the associations and the certifications, and get people to write references, post, articles, write blogs. Make yourself relevant in that space. It's a very, very powerful tool. And the beauty about LinkedIn, it gives you the ability to reach out to others and say, hey, can you connect me with X, Y, or Z? And 99% of the time, at least in my experience, most people will do it because there's no risk to them, really. The person can decide if they want to connect with you or not, but at least they can make a virtual introduction. And so don't sleep on the power of that platform. It can really help to strengthen your brand, get you a broader network, educate you in a lot of areas as well too, and help you in your job search.
Absolutely. Unfortunately, we don't have any more time for questions, but per what Christopher was saying, I encourage you all to reach out to folks on LinkedIn, and perhaps they'd be willing to talk to you about some of these other questions that were put in the chat. But moving on to resources. So we have an array of resources that we encourage you all to, pursue, including Minorities in Medicine, their website, their Instagram, my company, MelaninScience, our website, our upcoming programs such as the STEM Connect program, and our upcoming event, Black in Biotech. Christopher's podcast, Straight Out of Health IT, some different academic programs, HIMSS, and a health app building. And of course, please donate to Minorities in Medicine. So just want to plug an upcoming event that MelaninScience has coming up. We will be hosting a Black in Biotech panel on February 12th in honor of Black History Month. So if you have any folks who are interested in pursuing biotech or anything in the life sciences realm, we have a great lineup of speakers with an array of different backgrounds, from ag to biology to academia and startup. So feel free to register using the QR code in the corner, or you can register at our website, melanin-science.com/events. And I'll hand it over to Waverly for a upcoming Minorities in Medicine event.
Yes, thank you so much, Carmen. And I hope that everyone, you really were able to take a look at that resources slide, have a look at those QR codes, to maybe find some insight to some questions that we weren't able to get to today. If you are interested in continuing, a next actionable step that you can take is joining us for building scalable healthcare apps in March, on March 15th. Same time, 12 p.m. Eastern. That's 8 Pacific, right?
9 a.m.
9, excuse me. So come on in. This is going to be a crash course, and it will cover tools and techniques for building a secure and user-friendly healthcare solution. So very excited about that. We want to welcome you all to come into that. So with that, I just want to thank every single one of you all for joining us today. Thank you to all of our fantastic and talented panelists. And God bless you. We'll see you in the coming days and weeks and months. And have a great rest of your weekend.
Thanks, you all.
Bye, everyone.
Bye-bye.